Good morning to you. And in the studio, we do have Mr. Imran Osman, CEO of Avenue Healthcare Group. Sir, welcome.
Thank
to
you.
Radio 44. It's been, I think we've been speaking over the phone for a while, and it's pretty interesting, to have you right here in the studio. So let's get straight into it. First of all, from my understanding, you're an accountant by profession, right? But here you are, CEO of a prestigious organization, okay? How did that happen, and what was the journey like?
Well, through a lot of hard work, I must say.
Okay.
It's been a journey over 17, 18 years, been in the industry, 16 years particularly in healthcare.
Okay.
Worked in various levels from financial controller to finance and admin director to served as board advisor and gone into even board members of prestigious organizations within Kenya.
Okay.
And at some point then joined Avenue. But just to give you a sense of what the journey has been, I did high school, completed high school. Dad came from a middle class family.
Okay.
We struggled for fees, and he barely just took me through high school with my two sisters. And I had to, make my way because Dad just told me, look, I can't take you to high school, but university I can take only one of you. And
oh, wow.
then that was my sister, who was older than me, and
Right.
she went on to become an advocate of the High Court.
Okay.
But I had to chart my way, start working immediately after high school, and 19 years, and straight away decided to school myself with a certified public accountant. Barely attended classes because I could only afford exam fees. So I would work a day and study night and wait for my exams for 4 days, leave and get into the exam room and just sit the exams until CPA 6. But that's what builds you up for the future. Immediately after high school, after my CPA, I was CPA 1, and I got into an audit firm.
Okay.
The audit firm is where you enter with experience,
Right.
but you're just CPA 1.
Yeah.
And here you are working with CPA 6, and you are suddenly the supervisor of a CPA 6. And it was quite intimidating. And from an early age, I always knew, I'm an underdog and had to work hard.
Right.
Work twice as hard to measure up and
Yes.
live up to the expectations. Fast forward, joined one of the large organizations in Kenya as a healthcare, because they asked me to join them as financial controller.
Right.
Build my career from there, and this is where we landed. Been with Avenue Healthcare as CFO for the past. I joined last year, 2021. In
2021.
October,
Right.
and immediately after 4 months, was appointed interim CEO.
Okay.
And with interim CEO came a journey that I had to embark on. 11 months of interim CEO. I had to change my perception. I had to be more approachable.
Right.
Statistically,
Yeah.
it's only 16% of the CFOs make it to the CEOs, according to
CEO.
McKinsey. Yeah.
Wow.
And you have to change your entire dimension of thinking. CFOs are built to be cautious, to be questionable,
Right.
to be critique.
Not heavy risk takers.
Yes, and skeptic.
Yeah.
And here you are on a journey from doubling up as a CFO and CEO. And working with medics, it's comfortable to work with them now after
Right.
15, 16 years.
But
still, you are in a room and you have to contribute and be receptive to learn. So it's been quite a journey, and I have a great team at Avenue who make it even more easier. A board that is willing to listen, to invest, and passionate about transforming healthcare in Kenya.
Absolutely beautiful. That's good. We're going to go into a song right now. Then I think we do have to talk about some of the biggest challenges when it comes to healthcare in Kenya and, of course, globally, because you have access to all that knowledge as well. So keep it right here on Radio 44 right now, getting into this beautiful track, taken off to Juti Mebakar, coming your way. It is Show Me That Thumka. Don't go anywhere. Keep it right here. We'll be back on air in just a couple of minutes. Good morning to you. Good morning to you. Hope you're having a fantastic one. 26 minutes past 8 a.m. And in the studio with us, we have Imran Osman, the CEO of Avenue Group. We've been talking about your journey. Now, let's talk about something that I think all of us are concerned about, healthcare. And I have a question for you. What are the biggest challenges when it comes to healthcare in Kenya and globally as well?
So thank you very much. That's a very good question. Let me start from a global perspective and start from Kenya and then go to a global perspective.
Right.
Kenya, unfortunately, has 43% of its population under poverty line.
Yeah.
And a lot of diseases come out from there because of accessibility and such like things. Some of the diseases that you can look at is high burden infectious disease such as HIV, tuberculosis, malaria, but also mother and child, and particularly maternal death in mother and child. And that's something that we all frown upon and really avoid. In fact, if there is a maternal death at a delivery, that's a very, very high indicator of a lack of care.
Right.
So that's one area, poverty, that is affecting access to care and therefore health care. And we've not even scratched the surface of non-communicable diseases, which are perceived to be lifestyle disease up until recently.
Right.
You're looking at hypertension, diabetes, and so on. And when you look at what is causing this and what are the challenges that face it, some of them include limited access to healthcare, a lack of adequate personnel in areas, especially expertise to address some of these diseases, as basic as malaria, as basic as TB, how to treat it, poor infrastructure, reaching out to the medical centers. That has improved, but it's nowhere near where we need to be. And then ironically, we have facilities that are well equipped but lack personnel to run those equipment, to run those high-tech imaging machines and so on. So I know private sector is doing a lot to bridge this gap, but affordability still becomes an issue. So whereas when you get into private sector, what people don't understand is there's a lot of investment that is required to put up quality, to put up medics to retain them and so on. And therefore, while that gap is bridged between the government and private, all the private hospitals then become more expensive. In Avenue, what we've done is we're creating unique models to bring the cost down. Unique models means predictability. You're given access to your bill that you can actually predict what's going to happen. We start checking lifestyle. We start checking how you're getting into the deeper of your health issues, not just treating the care, not just treating the disease. We're looking at health care as a whole.
As a whole, okay, understood. Although, then here's the other thing. We live in Kenya, but a lot of people have this common belief that, when it comes to basic healthcare, you can do that in Kenya. But when it comes to complex surgeries, they only think about India. Is there any truth in this statement?
Well, there is some truth. 97% of those who sought medical care actually went to India, and majority of them are looking at statistically. When I looked at the MOH stats, about 37% were looking at cancer treatment. Cardio was 19%, renal cases were 12%. So all of these services that are being sought out in India, unfortunately or fortunately, are very much available in Kenya. So if you look at cancer, and breast cancer is most prevalent, it can be treated and managed in Kenya by many facilities, including Avenue. Cardiovascular diseases, which is another case where people go out, especially to India and South Africa, to get treatment, is available in Kenya. And dialysis, the government has done tremendously to offer NHIF cover for 100% rebate on dialysis, which is renal. So all these services are available, but what happens here is it's high costs, and many people who are asked why do they seek care in India is because in Kenya it's high cost, long waiting periods for treatment because the surgeons are not easily available, lack of specialized medics and equipment.
Okay.
But let me give you my personal perception about this. In my opinion, it's not just the lack of care or equipment or personnel. I think it goes beyond that. It goes to trust. There is a lot of inertia when it comes to, like you just said, Kenya is just known for primary, and if I need specialized care, let me go to India. So it's a fundamental point where we as medics and people who work in the healthcare industry need to transform healthcare in creating trust with the people. For example, why are we in many organizations having to charge you to give you your MRI scans, to print that for you?
Right.
Why don't you have your lab tests available to you in your portal?
Right.
Why do you have to go to the pharmacy around the corner in the hospital to print out your prescription?
Yes.
Why don't you have it available for yourself? So what we are doing in Avenue is we want to transform that. We want to change the narrative. What we want to do is give you a single electronic medical record available to you across our integrated health system, where we have 16 clinics across the country, 3 hospitals across Kenya, 1 in Thika, Parklands, which is known, and also Kisumu. So when you walk through this journey of continuum of care, you have access to your medical record. Transparency, therefore, is what in your billing process, in the entire journey. And what we have done particularly is we are so confident about our services now, and we're building on it. We're not perfect, we're getting there. We are displaying our Net Promoter Score on all our screens. Unedited patient feedback. When you enter Avenue in any of the facility, you will see it displaying how you perceive us. So it's the trust that we really need to work on and move from there.
Excellent, excellent. Thank you so much. We will be coming back shortly with more discussions about healthcare. Keep it right here on Radio 44 right now. Shamar will let the music playing right here on Radio 44. Hope you're having a fantastic morning. In the studio with us, we do have Imran Osman, the CEO of Avenue Healthcare. Welcome once again. We are still talking about healthcare. Now, healthcare has become one of the most prioritized needs in the world right now. We are seeing times completely change. Pandemics have just gone up all the way. Fast diseases like Zika, the return of Ebola, and of course, right now, coronavirus. What is the most effective way to tackle such health emergencies?
Well, it's a good question. I think there's a lot of fear and concern around COVID and also the infectious diseases. There's a lot of research going on, and it has pushed healthcare and also innovation in healthcare at a level where we've never seen. Like even the COVID vaccine, where it came about at the shortest period of time that we could see. AI in healthcare is also improving. I remember we had actually treated and discharged over 4,200 COVID patients in Avenue during that pandemic period.
Oh, God.
And right now, we're looking at barely 100 patients since then with COVID, although they're not, people have stopped testing for COVID, but it's still there, it's still in the air, it's become a flu, it's become a seasonal thing.
Yeah.
But as global climate changes and lifestyle changes, as with droughts, you have infectious diseases coming up, you have cholera coming up. We have to go back to the basic fundamental. How do we manage basic hygiene, strengthening prevention and response capacities, improving our readiness, how do we respond, and strengthening primary care. And primary care, you would think, washing hands is a basic thing. But by doing that, when I was talking to my quality team last week, and they were saying, we need to do a video on how to wash hands. And I'm like, yes, I understand, but don't you think we've overemphasized this? And so you can never overemphasize this. It's an international patient safety goal. And there's a procedure of washing hands, there's a procedure of using hand sanitizers, hand rubs, and so on. So we really need to go back to basics. We need, as organizations and also the government, we need to collaborate with PPP in prevention and healthcare, and also education on this.
Right, okay, great. So we'll be coming back shortly. Right now, getting into the music. We are still talking about healthcare right here with Imran Osman, the CEO of Avenue Healthcare Group. Good morning to you right now. Time coming to 11 minutes to 9 a.m. Hope you're having a fantastic one. Keep it right here. More music and, of course, more hits coming your way right here on The Morning Fix on Radio 44. Amazing track right there, bringing you the energy right here on The Morning Fix. We are with Imran Osman, CEO of Avenue Healthcare Group. Once again, great to have you. So we're seeing healthcare generally considered very expensive. You also mentioned this just a while back. And it's not just in Kenya, globally as well. I have family in UK and they also complain about the same problems. And, this means a lot of people are left helpless and they don't stand a chance to survive. So the real question is, can this be tackled? How can it be tackled? Or is this just the way of life as we see it?
No, it's a very good question, and I think we're all victim to this. As statistics says, most Kenyans are an admission away from poverty.
Right.
And I think I want to take a different approach to this, and I want to debunk the philosophy of saying healthcare is expensive. How I want to debunk this is just talking about the health-seeking behaviors that we in Kenya and also globally have. I think we in Kenya particularly are procrastinators. We procrastinate a lot. Let me explain. Have you filed your tax returns?
I'm waiting for the last day.
Exactly.
There you go.
Right? So when you wait for the last day, we wait for the last hour to go to the polls to cast our votes.
Yes.
You'll find the highest line or the largest number of people in the line at 5:30 or 6 p.m. before just the poll closes.
Right.
And that's actually working against us. In healthcare, for example, and men especially, to be honest, you would wait for that tooth to ache so bad before you go to a dentist. You would wait for that pain on your knee to get so worse. And suddenly, when you need the care, you need a knee replacement.
Right.
And that's the problem. What we need to do is we need to change our health-seeking behavior.
Okay.
And how do you do that is you have to be in touch with your family medicine doctor. And we used to do that in our olden days.
Yes.
There used to be a doctor going around with their briefcase. They would come in with an old Peugeot and walk into your house and do a call at home. And that family doctor had your history, had all the information about your dad, your mom, and so on. And especially in the Asian community, that was very predominant. In the larger extent in Kenya, we are not doing that. Yeah? So what we should do, we should start changing our lifestyle, our health-seeking behavior. I was speaking to you earlier and telling you, as healthcare providers, I think we are to blame.
Okay.
Yeah? Because there are three fundamental changes that need to be made. One, getting the coverage is something that people... healthcare is a grudge business, so to speak. Somebody comes to you, they do not want to come to you. It's not like a hotel or a resort.
Yes.
When they come to you, it's bad. There's a huge waiting area filled with patients who are also sick. So straight away, you're mentally, captured. You're not in your state of mind. We are not clear about your benefits. What is covered in one? You don't know what's going to happen in the next phase of your journey. You've come for consultation, suddenly you're sent to lab from diagnostic and so on.
So you bounce around,
unpredictable.
Agreed.
Then finding care and savings and paying for the care. People don't understand that. So it's important that we start debunking this. And what we are doing in Avenue is we are changing that lifestyle, even in terms of your journey in healthcare when you approach us. For example, our newest clinic that we are opening, and it's an extension of Avenue Parklands.
Okay.
First of all, we've renovated Avenue Parklands tremendously. We've enhanced experience. We're going to have more parking spaces in the next couple of days. We've opened an extension in Broadwalk, which is separate from your heavy traffic, heavy chronic care, heavy patient flow. So Broadwalk has an annex to the hospital where we're going to have a dialysis treatment, which is state of art, better ambience, you have ophthalmology, you have dental, you have family medicine doctors and so on. So you can actually book your appointment, and I encourage everybody to start changing their health seeking behavior, and that's what is going to change the narrative. Visit in Broadwalk and see what kind of changes we are making to the healthcare infrastructure and the ambience and the experience that you get. It's not your contemporary hospital.
I think that's brilliant. That's the kind of place that someone will feel comfortable going into. Thank you so much for your time, sir. And I think this this is very transformative, and that's the kind of transformation that we'd like to see in the healthcare industry. Because I can tell you right now itself, my knees are creaking a bit, but I'm just waiting for the right time, and I think the right time is now.
Yes.
And once I get something like that into my system, then yes, I wouldn't have to pay through my nose or, you know, through the roof to actually correct everything. Thank you so much for your time, sir.
It's a pleasure. Thank you. Thank you for having me. Yeah.